It's actually very difficult, and it's a problem we often have when patients have been started on these medications, that because dependence rather involves a lot of symptoms that will occur when you try to come off these medications, including a worsening of pain, that it's very hard for patients to come off even if they're not getting good pain relief, or even if they may be better off once they come off.
Anybody who's been on opioids for a long enough period of time knows that you just don't say, you know what, I've had enough of this. Not going to do this anymore today. I just won't take my pills tomorrow, like I won't take my Lipitor tomorrow. That doesn't work. The next day, you're very, very sick if you don't take those pills.
It's a combination of feeling a severe flu-like illness along with very, very intense anxiety, really almost identical to a panic attack. But whereas a panic attack is something that's very brief, most panic attacks last 30 minutes. The anxiety that's experienced in opioid withdrawal is like a prolonged panic attack. So there's this sense of impending doom. People truly feel like they're going to die when they're experiencing opioid withdrawal.
Most people can tolerate the flu for a week. If you think that you could get instant relief from it, though, by just putting some more of the pills in your mouth, it's pretty hard to tolerate the flu. So in that sense, stopping, well, as Mark Twain once said about smoking, stopping is easy, I've done it hundreds of times.
I've been through 7 operations in my life. Nothing has ever compared to that, what I went through. Nothing.
There are protracted withdrawal symptoms from opiates that have been well described since the 1950s that go on for months, with sleep problems, with appetite problems, metabolic abnormalities.
My body screamed and yelled for a year. I had leg kicks that I didn't understand for a year after. I went to a rehabilitation place in Chicago to try to understand what my body was going through because I was so sick.